You know what's terrifying? Your grandmother could be walking around right now with a ticking time bomb inside her body, and she has no idea. I'm talking about high blood pressure in the elderly. And here's the shocking part. Over 65% of people over 60 have it, yet half don't even know they're affected. Sounds impossible, right? No symptoms, no pain, no warning signs, just silence. Until one day, bam, stroke, heart attack,
I've lived a
kidney
long life.
failure.
The
But
most
here's
important
what
thing I've
shocked
learned is
me
to connect
when
with
I
others.
dove deep into
Your
the
stories matter.
research. This silent threat is actually screaming at us with signs we've been ignoring. Stay with me, because what I'm about to reveal could literally save someone you love. And trust me, by the end of this video, you'll never look at your elderly relatives the same way again. Let me tell you something that doctors don't always explain clearly. High blood pressure doesn't work the same way in a 70-year-old as it does in a 30-year-old. And that's exactly why it's so dangerous. Here's what happens. As we age, our blood vessels become stiffer. Imagine a garden hose that's been left out in the sun for years.
The results show a minor
It loses
irregularity. It's
flexibility
treatable, but we
when
need
your
to monitor
heart
it.
pumps blood
Do you have
through
any
these rigid
questions?
vessels. The pressure naturally increases. But here's the crazy part. Your body adapts so well to this gradual change that you feel absolutely nothing. Key fact. Research from the American Heart Association shows that elderly people's pain receptors and body awareness decrease with age, meaning they're less likely to feel warning signs like headaches, dizziness, or chest discomfort that younger people experience. Think about your grandparents for a second. How many times have they said, "Oh, I'm just tired," or "It's just old age"? That's the silent threat talking. They're attributing serious symptoms to normal aging when their blood pressure could be silently damaging their brain, increasing stroke risk by 300%, heart doubling heart attack probability, kidneys leading to kidney disease in 40% of cases, eyes causing vision loss you can't reverse. And here's something even more surprising that you need to understand about why this matters right now. You're probably wondering, what counts as high blood pressure in the elderly? And this is where it gets interesting and controversial. For decades, doctors used the same standard for everyone. 140/90 mmHg or higher meant high blood pressure.
The risks are significant, but the
Simple,
potential benefits
right?
cannot be
Wrong.
ignored.
Recent
This information
studies have
requires careful
completely flipped
consideration.
this understanding, and the medical community
It's
is
a
still
relief to
debating
feel
it.
this way
Here's the
again.
real question. Should we treat a healthy 75-year-old the same as a 75-year-old with diabetes, dementia, or heart disease? Because research from the SPRINT trial, that's 9,000 plus participants, showed that aggressively lowering blood pressure to below 120/80 inches, elderly patients reduced heart attacks by 25% and deaths by 27%. Sounds amazing.
I know this brings back
But
memories,
wait,
but
there's a
please
catch.
share your thoughts.
That same
Your
aggressive
perspective is
treatment
important to me.
increased falls because of dizziness, kidney problems, and dangerous low blood pressure episodes by 30–40%. Let me paint you a picture. Your grandmother takes her blood pressure medication, stands up to get water, gets dizzy, falls, breaks her hip, and ends up in a nursing home. All because we were treating the numbers instead of treating her. The truth doctors are learning. For elderly patients, the ideal blood pressure depends on overall health status, mobility and fall risk, other medications they're taking, cognitive function, life expectancy, and quality of life goals. Let's be honest, a frail 85-year-old with dementia needs a completely different approach than an active 70-year-old who hikes every weekend. But here's what's crazy. Many doctors still use the one-size-fits-all approach because it's easier than individualizing care. You know what's even crazier? What I'm about to show you about how this silent threat actually announces itself. Now here's where it gets really interesting. I said high blood pressure is silent, right? But that's not entirely true. It does give warning signs, we've just been trained to ignore them. Let me tell you about Mrs. Chen, a 68-year-old patient whose story changed how
Listen
I think
closely.
about this
The
forever.
key to this process is understanding
For
the
6
variables
months,
involved.
She complained
This
about
will influence the final
waking up
outcome
with mild
significantly.
headaches, blamed on her pillow, occasional nosebleeds, blamed on dry air, feeling slightly confused, sometimes blamed on senior moments, fatigue in the afternoon, blamed on poor sleep, Everyone, including her doctor, initially dismissed these as normal aging, until one routine checkup revealed her blood pressure was 178/95. She'd been one bad day away from a stroke for months. Here's the shocking part. When researchers analyzed 1,200 elderly patients with undiagnosed high blood pressure, they found that 83% had reported at least 3 of these minor symptoms to family or doctors in the year before diagnosis. Morning headaches, especially at the back of the head. Unexplained nosebleeds. Blood spots in the eyes, subconjunctival hemorrhage. Facial flushing or redness. Dizziness when standing up quickly. Unusual fatigue or weakness. Confusion or difficulty concentrating. Irregular heartbeat or heart palpitations. Chest pressure, not pain, just tightness. Shortness of breath during normal activities. The problem? These symptoms are so common in aging that we've normalized them. It's like your body is sending smoke signals, but we keep saying, "Oh, that's just fog." Here's a relatable way to think about it. If your car was making a weird noise, you'd check it out immediately, right? But when Grandma says she's been a bit dizzy lately, we nod and move on. We treat our vehicles better than our loved ones' cardiovascular systems. But that's not the crazy part. The crazy part is what happens when these signs are ignored for too long. Quick thing before we dive into the really critical stuff. If you're finding this valuable and thinking, wow, I need to share this with my family, do me a favor, smash that like button and hit subscribe. It genuinely helps more families discover this life-saving information through the algorithm. Plus, tap the bell notification because next week,
blood pressure is 120/80,
elderly
heart rate is 72 beats per minute,
that could literally
temperature is
prevent
98.6
thousands of
degrees
deaths.
Fahrenheit.
Trust me, you don't want to miss it. Now, back to why ignoring these signs creates a domino effect that's absolutely devastating. Let's be honest, when most people hear high blood pressure, they think heart attack and stop there. But the reality is so much worse. And this is the part that should make everyone sit up and pay attention. High blood pressure in the elderly doesn't just attack one organ. It's like a silent army launching a coordinated assault on your entire body at once. Let me break down what's actually happening inside. The brain cascade. When blood pressure stays elevated, tiny blood vessels in the brain start to leak or burst. We're talking microscopic damage that accumulates over years. Recent neuroimaging studies showed something terrifying. Elderly patients with untreated high blood pressure had 40% more white matter lesions, basically tiny scars on the brain, compared to those with controlled pressure. What does this mean in real life? Your sharp, witty grandfather slowly becomes forgetful. Not dramatic Alzheimer's level, just subtle enough that everyone says he's getting old. But it's not age. It's vascular dementia caused by years of high blood pressure quietly strangling his brain cells. Shocking statistic. Studies show that controlling high blood pressure can reduce dementia risk by up to 20%. That's massive.
The path of wisdom is often found in the quiet spaces
preserving
between
someone's
words,
identity,
where true
memories,
understanding takes
and
root.
independence for years longer. The kidney destruction. Here's something most people don't know. Your kidneys are basically millions of tiny filters, and high blood pressure destroys them one by one, irreversibly. The elderly are especially vulnerable because they've already lost 30–40% of kidney function just from normal aging. Picture this: a 72-year-old with uncontrolled blood pressure for 5 years. Her kidneys are working overtime, filtering blood under extreme pressure. One by one, those filters, called nephrons, die. By the time symptoms appear,
I know it's
swollen
hard to
ankles,
believe, but the results are
fatigue,
consistent.
nausea, she's lost
Every test we've run points
60–70%
to
of
the same
kidney
conclusion.
function. And here's the kicker: you can't get that back, ever. The heart's silent surrender. Your heart is a muscle, right? When it has to pump against high pressure constantly, it does what any muscle does. It gets bigger. Sounds good? It's not. This is called left ventricular hypertrophy, and it's basically your heart saying, "I'm exhausted." A thickened heart wall can't relax properly between beats. It can't fill with blood efficiently. Eventually, it leads to heart failure, not a heart attack, but something arguably worse. Your heart is still beating, but it's so weak that you can't walk to the bathroom without gasping for air. And thanks to modern medicine, we can now keep people alive in this state for years. That's my attempt at dark humor. But seriously, quality of life matters more than just survival. The real question is, with all this damage happening silently, how do we catch it before it's too late? You know what's crazy? We check our phones about 96 times per day on average. But how often do elderly people check their blood pressure? Maybe at the doctor's office twice a year if they're diligent. And that's the problem. Here's what shocked me when I researched this. White coat hypertension, high blood pressure, only at the doctor's office due to stress, affects up to 30% of elderly patients. The opposite is even more dangerous: masked hypertension, where blood pressure is normal at the doctor but dangerously high at home. Let me tell you about Mr. Rodriguez. Every checkup, perfect, 125/78. His doctor was thrilled, but his daughter bought him a home blood pressure monitor for Christmas, and guess what? His morning readings were consistently 165/98.
These morning headaches are tough. Then the dizziness hits.
For 3
and afternoon
years,
fatigue.
His blood pressure had been dangerously high 90% of the time, but the single measurement at the doctor's office made everyone think he was fine. Critical insight. The American Heart Association now recommends home blood pressure monitoring for all elderly patients because it's up to 300% more accurate for predicting actual cardiovascular risk than office measurements. Here's the thing, and this is super important. Elderly people need to check their blood pressure in the morning, within 1 hour of waking, before medications, in the evening, before dinner, when they feel off, dizzy, headache, fatigued, at least 3 times per week if they have hypertension, daily for 1 week.
I know things feel tough right now, but you're stronger than you think.
But wait,
keep going.
It gets better, or actually worse. Because even when we catch high blood pressure early, the treatment approach for elderly patients is where things get really complicated. Now here's where things get interesting, and honestly, a bit frustrating.